Tips to run a great telehealth appointment on today's Medical Economics Pulse.
So with this, one of the things that's going to come out of this virus is a bunch of educated clinicians on telehealth and a bunch of educated patients. And so I think that it's a good thing, but it's also provider practices that aren't thinking this is a short-term solution, and that they can go back to doing business the way they were. I think it's a bit short-sighted, to be honest with you, and that there are going to be a large amount of their patients that can really gain a lot from telehealth.
Telehealth is all the rage today. Both physicians and patients are grappling with how the COVID-19 pandemic has impacted in-person healthcare treatment. But it's one thing to provide virtual care. It's another thing to provide good virtual care. Today, we are joined by Haden, the president of DRexly Health Solutions, to discuss how physicians can create a sustainable telehealth program that gets results, that patients enjoy, and that the entire practice can be proud of. Haden, thanks very much for joining us today.
Thank you very much, Chris. Appreciate being here.
So the first thing I wanted to start with was talk about telehealth and maybe some of the misconceptions that are out there. Can you talk about some of the main misconceptions that physicians have about telehealth and sort of kind of cut through the sort of the fact and fiction of those things?
Sure. I think quality of care is a big misconception. That it's going to replace face-to-face visits is another misconception. It never will replace that. In fact, I would even argue that the word telehealth will be removed from the dictionary in 20 to 25 years. It'll just be called healthcare. It's just another modality of a way of treating your patients. So I think that that's a big misconception, that it's going to replace the physician. Another one is that it's going to make the practice more efficient. It can, absolutely, but it can be, in the initial phases right now, it's going to be a bit of an administrative burden, just to be very not sugar-coated. However, it will be extremely efficient and something that the patient's going to like. The patient's going to like the fact that they can be at home, they can be at work, they can take a break in the car and see their doctor, and not have to take an entire day of work or half a day of work to travel an hour and a half. So with this, one of the things that's going to come out of this virus is a bunch of educated clinicians on telehealth and a bunch of educated patients. And so I think that it's a good thing, but it's also provider practices that aren't thinking this is a short-term solution, and that they can go back to doing business the way they were. I think it's a bit short-sighted, to be honest with you, and that there are going to be a large amount of their patients that can really gain a lot from telehealth, that will improve outcomes on a lot of things that providers don't think about.
I wanted to ask about next was, so right now, lots of physicians will be implementing new telehealth programs. And I think one of the key things to do is to communicate that you're now offering these services to your patients. What sort of ways do you advise practices and physicians to sort of inform their patients that this is available, and to sort of walk them through how they can connect with your practice virtually?
Right. So I would practice is the first rule of thumb. So whenever my clinicians come on board with us, we encourage to do test patients. I have a setup account as a test patient. One of the things that I think is kind of a barrier for telehealth is that nobody likes to be on TV. And even this video call right now, at least thing I want to do is be on TV, right? So that's a natural avoidance for everybody. The other one is that that the patient needs to be onboarded as well as the clinician. So if prior to the appointment, you want to reach out and say, hey, we have telehealth, are you interested in doing it? You can post the instructions on your website, you can email them, and then prior to the appointment, the day before, do a dry run. And this is not the physician. This could be the receptionist just doing a dry run on the system to make sure they're up and running. So again, telehealth is a team delivery model. And even though it's a solo practice, a lot of the prep work can be done beforehand to have the patient engaged. And then many patients will pick it up very easily. They just open up the app and they're in the waiting room. So the patient provider clicks the button, I've literally had one of my clients, it was 5 minutes literally before a new patient was to be seen on telehealth when they were first coming up. In 4, we had the patient set up and ready for the provider to get seen. And it was that quick for somebody with some practice. And for the clinicians, as we all know, repetitive high volume is really the key to improved outcomes. That's why you get your heart transplants done at a hospital that does a lot of them, because they practice at it.
Yeah.
And if you don't practice with the system, you're not going to be very good at it. So you want to use the system a lot. And the other piece for that is condense and designate a day or two a week for telehealth. And that way everybody's kind of getting a rhythm on it, and it's not as choppy either, is the other thing I'd recommend.
Okay, great. So, one of the things that, as someone who's now doing, remote videos, sort of modified media telehealth right now, how do you make both clinicians and patients comfortable on video? Like you had said that, nobody wants to be on TV, and, physicians have trained for years, decades, to have like a bedside manner, and that they're seeing the patient, they're able to look them in the eye in person, and
I can
all
see
that
your
body
eyes,
language
Chris.
stuff,
Chris,
so like, how do you sort of make yourself comfortable to sort of relate to a patient, to ease the patient, to be comfortable yourself, all those type of things? What kind of tips do you have for that?
Again, practice. On a telehealth platform, you can add a family member to the visit. That family member can be across the nation. So oftentimes, I train the clinicians to include a family member, especially for the elderly one. Or I have several autism treatment for spectrum disorder where we're using telehealth. And you would think, well, how do they do that for treatment of autism? Well, what happens, instead of going to the home, the counselor is on video. The parent is there, the child is there, and actually the child is in the environment that they need to learn about what the trigger mechanisms are for their autism. The other parent, who may be remote, they may be divorced, may be at work, can join the session as well. And so there's a lot of support in that, getting used to the video. Myself, I'm pushing 50 here. I'm not as comfortable on video. My 17-year-old son, he doesn't even watch TV, right? So he's very fluent in it. So it is a generational thing, and it does take some time to get used to. It's a different way of evaluating the patient, but I would be happy to share some studies on how to do it and talk about it from, even though I'm non-clinical now, having been a former paramedic, I could talk a little bit about clinical stuff, but I would defer to my medical experts on this and get some guidelines for the show on how to conduct an exam and just get comfortable with it.
Yeah, that sounds perfect.
Yeah.
What I will ask about in terms of the sort of the mechanics of the appointment is how should more about like the logistics of conducting the appointment. Can you kind of talk through some of the ways that physicians can conduct an exam while being, across a computer screen rather than?
Well, Chris, if we were on your phone and I was a clinician, first thing I would do is, hey, Chris, can you take your temperature? What's your weight? Everybody's got one of these at home nowadays. If you have a blood pressure cuff, check your blood pressure. What's the history of it? If you're diabetic and on taking your blood pressure, your blood sugar readings, what are your blood sugar readings? You got some pain in your joint? Why don't you move your elbow? Does that cause pain? You take the phone, if the patient's on their phone, it can be done with a webcam as well. It's a little prettier on the phone. But if you want to do some basic evaluation for your seeing the patient, you're going to need to check the ears. You're going to need to check if it's a rash. Well, these phones are very high definition pictures. So my son had a rash, for example, from wrestling. And my wife said, let's go to the urgent care. And I said, I can't, I'm busy with work. So literally turned here and took a couple of pictures with my iPad and had a board certified dermatologist say it was impetigo, and we had medication within 24 hours for him. Because the definition of the images is so well. That's a remote consult. That's telehealth right there. The other thing with the phone is if you're is flip and reverse the camera. You can have the patient open their mouth to look in the back of their throat. up in there is, remember the camera on the phone when it's on has a light. So you can see and observe quite well a lot of the physical features of it. It's not as good as a face-to-face, yes, but it's pretty close. If you have a family member that's with you, you can actually have the family member palpate the abdomen for the patient if they're having abdominal pain. And you'd be surprised how many appendicitis have been identified. When you touch a patient that has an acute appendix, I think most clinicians know a little touch, they come off the bed or the table, right? Well, right then and there, you've triaged the patient to know that they need to go to the emergency room. They need to be escalated to care. They would be escalated from care if they were in your office. You would escalate them to the hospital for surgery. So I see telehealth as really a great way of addressing a lot of low-level acuity needs and triaging the patients, if you will, and then escalating them just like you would do in your office to evaluate if you have something that's more serious than you can handle, is then moving them into the right channel. If it's a broken arm, they're not going to get on the phone, right? They're going to the emergency room. But if they got a stiff joint, you can, ambulate, walk, touch your toes. These are all part of a physical exam.
Thanks for describing, sort of some of the mechanics of the appointment. I think that's really helpful for doctors to sort of translate between what they know about conducting an in-person exam and sort of translating it to telehealth. The one thing I wanted to ask about is when you have patients who aren't used to the technology, whether maybe it's an older patient, maybe they have multiple chronic conditions. You had mentioned having a family member around, but I'm just wondering how you kind of navigate some of these challenges for patients that you would normally see in person. The type of people, I definitely want them in the office. But now, given the pandemic, how do you sort of navigate some of those more complex cases via telehealth?
So here's a great example is I have a type 1 diabetic son diagnosed a little under a year ago. I'm okay with sharing his blood sugar. I'm remotely monitoring. He happens to be upstairs right now, right? So he's at 188 and climbing. I'm going to get an audible alarm when he hits a certain level and holds that long. That is telehealth in action. Now, it's an app on my phone. And so some of those conditions in telehealth can really be expanded to connect. My platform connects with Dexcom when you get to a certain level, right? And that's where, you can have remote stethoscopes and listen to the heart. You can have otoscopes as well. Again, though, that doesn't make sense quite yet on this, but a lot of those things can replicate. Now, getting the patient used to it is it just depends on the demographic and the cultural needs and social economic needs of the patient. All phones work, even those phones that are given due to being on the WIC program or for low income, the apps should work. And those folks have really a challenge getting to a normal visit already. Not only do they have transportation needs that aren't being addressed, telehealth addresses the bus trips, right? That most buses should be shut down right now if they're not on, but their phone will work. On our platform, it's designed to work on 3G level bandwidth. Now, it's not perfect. I'm not gonna, but it can get the job done, especially during right now in the crisis. And working with the patient, again, it's having your staff prep the patient and kind of talk about what the exam is going to be. Make sure you educate your patients about others being in the room and confidentiality. If you're talking about substance abuse and you're doing an evaluation for Suboxone, you don't want all his buddies hanging in the room. You need to give them a heads up. Most of the time, they're already aware of that. They'll be on headphones, or there's other ways to ensure privacy so that not the whole house hears a visit.
So one of the things medical economics always tries to encourage is physicians to take in our content and use it for continuous improvement on many aspects of their practice. So I'm wondering, in terms of telehealth, it's one thing to get started. You're seeing patients via telehealth, but what kind of way can you get patient feedback so that you can continually improve your processes. It's sort of like that cycle of try something, collect feedback, improve. Can you talk through a little bit about how you can take telehealth and make it like a great telehealth program?
Yeah, my platform has it's set up so the physician can select an option to have the patient rank this visit and make comments. Remember, Amazon got very popular because the readers were rating the books, and it totally did a dynamic shift on how a lot of book publishers didn't want the readers to rank the books. Well, you want your patients to have a anonymous way, if you will, or disassociated way of doing a survey. And telehealth can do that. So they can just rank it on the stars and copy it. And you want to measure that as an aggregate. And that's all encaptured. It takes 30 seconds for the patient to give you a 1-star or a 5. So that is one example of starting to measure patient satisfaction with that immediately. And then, of course, following up with them after the visit, just to ask them how it went, if there are any concerns, and getting that kind of direct feedback, email, secure messaging. There's a lot of ways to ask them for direct feedback on the spot. Whenever I get done with a lot of times I get a patient satisfaction survey that's 10 pages long. It goes into garbage. Well, you could just send a secure text. Hey, just wanted to see how you're doing. What'd you think of the video chat visit? The patient can respond directly back to you in a HIPAA secure, direct manner, so that that confidentiality is maintained, and they can share with you before the next visit. Hey, I couldn't see you. Your office was too cluttered. The audio had feedback reverb. Those kinds of things that you don't think about face to face, and you don't necessarily hear on your end, the patient can hear. So,
okay, great.
Question. Yeah.
I got my fingers crossed. I want to sort of envision, beyond this crisis. So right now, a lot of practices will be doing a lot of telehealth and not seeing so many in-person patients. And I'm wondering what advice you have for them to sort of, after they've sort of done their telehealth workout, they're feeling like they're in shape to do this stuff, to not let that atrophy once they can start seeing patients in their practice again. How do you sort of integrate between the two once things get back to normal? What advice do you have to do that?
I would pivot to consultations. So one of the biggest issues that at least in my area where I live now, is practices are still faxing consults out to other specialists. Well, telehealth addresses that. You can be securely connected to a specialist physician, send a consult and track it, and the provider sends you back the results. So the days of primary care faxing out consultations and referrals and it going to abyss, that should be going away in the next couple of years, in my vision of it. And that is that interprofessional consultation is a form of telehealth. You can do primary care can talk to the specialist on a referral over live video and looking at the same medical records, screen sharing them, and getting direct live engagement right there on the spot. That's a billable event under Medicare typically. You can't do that necessarily over the phone. And that's going to be whittled away. I mean, so whether you like it or not, a lot of the regulations have been shifting to telehealth already. I've written several articles about that. I think there was 156 state regs or laws passed last year that furthered telehealth adoption. At the federal level, there were several. This last passage of the federal funding act for the coronavirus, the $2 trillion, has a lot of telehealth language in it that's going to make things permanent adoption. So once the pressure's off, reevaluate, and there's a lot of opportunities, but at that chance, you'll have a good foundation to know, wow, this really works here, it doesn't work here, and enough knowledge. The other piece I strongly recommend clinicians do is it's not required in many states, some it does, Kentucky and Washington I know it does, take CMEs on telehealth. You get your education done that way, plus it gives you a non-biased resource on what's available. And again, I'd encourage clinicians and others to get a couple of different guidances on there and what you can and can't do on telehealth.
That's great. I think it is important to sort of emphasize the opportunity. One of the things we're hearing all the time from physicians is that the challenges. Operating a practice is becoming more challenging. And what it sounds like to me is that telehealth is a potential opportunity to both grow revenue, grow your patient base, and all those things. So can you talk a little bit about, as we're dealing with this awful epidemic, can you talk a little bit about the opportunity that it perhaps presents to physicians?
Yeah, I have a lot of physicians that might provide primary care, and then they specialize or they offer a concierge type service. Let's say it's men's erectile dysfunction, prescribing Viagra or weight loss or something like that. And that's a cash revenue source for them, those services. Well, telehealth can easily be integrated in there. And so you can take for that business, you not only can make that a concierge channel, if you wish, you can then see the state. It's very easy to get licensed in multiple states for a physician. The laws for telehealth, the one thing to keep in mind is that where the patient's located is what drives the law. So if the patient is in Boise and you're in Washington, what is allowed in Idaho is what needs to be followed. So you get licensed in Idaho, and then you are able to see that patient in Idaho. So that's one revenue channel, if you will, or improvement. There is efficiency to be gained through telehealth with doing medication refills, let's say. If you have an intake form where you're able to do the review prior to, that is store and forward type of telehealth that may not require a video visit. In other words, the patient submits their intake form to be re-prescribed that existing medication. Now, again, I would check with the state laws in your code, right? But most of the case, the provider can spend the evening going through all these forms that are already been pre-filled. And if the patient is being seen for a condition, have you had your blood pressure checked in the last 90 days? And you click no, get your blood pressure checked. Here's a pharmacy right down the street. That in other words, is cleaning up the intake form. Mm-hmm. It's making the patient conduct the necessary steps prior to the exam, so that when you're presented the patient, whether on video or the form, you're making sure that they've already ruled out things that they need to take place. Hopefully that makes sense.
Yeah, definitely. My last question is just, is there any tips or advice you have for physicians about telehealth that we haven't talked about?
Be patient. I had a provider that signed up on our platform that was ready to terminate me that next night because it wasn't working. And when I found out what had happened, he was trying to access the patient link to sign up. And of course it doesn't work because the system is designed, the patient has an access point. I don't call it a portal because a patient can actually access a physician as the physician sets the rules up. But he was trying to access his provider side using the patient link, and he just got it mixed up. And then I haven't heard from him since. In other words, it was agreeing. So you just got to be patient, and it's going to be bumpy for everybody right now. Systems are overloaded. Think of those who are a little older, AOL, when they went to an unlimited subscription account in the 90s. You couldn't even get on the internet. It was a nightmare. Same kind of thing is happening here as well. We're very lucky that Netflix is still up and running, but even they are downgrading their stuff. So just some patience is one, and don't make a big commitment with any vendor. I would be very leery of 12-month contracts for this. There's plenty platforms out there that allow you to get on for month to month or something reasonable, because every platform is not for every provider. And to do some due diligence the best you can and have a walk away that you can try something and then realize you may have to pivot into something else or grow with it. Ideally, you find a platform that you can grow with, but it's hard to see how you're going to grow if you're just learning about telehealth today.
Eric Haden, thank you so much for joining us.
Thank you very much, Chris. Appreciate it.